everyone, this is Perspectives, a podcast by Street Medicine Detroit. I'm Dee.
And I'm Austin. And today our guest is the nurse practitioner at the neighborhood service organization Tumani Center, and also the lead clinical preceptor for Street Medicine Detroit. Welcome to the show, Dean Carpenter.
Thank you.
We want to get to know you a little bit before we dive into things too much. First of all, thank you for being with us. But can you just give us your story and your trajectory of how you came into this role and kind of how street medicine itself was formed, because you were there for the entire forming of it, really.
Yeah. So I got the job at NSO sort of by serendipity. I was working as a staff nurse at a hospital, waiting for a position as a nurse practitioner after graduating grad school. It was a long time coming because I'm a family nurse practitioner, and they really wanted someone who was an acute care nurse practitioner. And so I was butting up against the recertification. You have to have 1,000 hours in your specialty to recertify, or you have to write the boards over again. So I was kind of desperate for any job, and just answered an ad in the Detroit Free Press. This tells you how long ago that was. And that was at NSO, Tumani Center.
And when was that?
It was in 2006.
2006, wow.
It used to be called the 24-hour walk-in center back then.
Wow.
So you came to work at NSO kind of by accident,
right,
just responding to an ad. But if you had known about the work that NSO was doing with the population and based on your experiences now, would you have conscientiously chosen to work?
Yeah, once I found out how great the job is, I would have jumped at that chance. Yeah. It's one of those jobs where you look forward to going to work in the morning. When you wake up, it's like just gratifying thing to be able to do, and the autonomy too. It's like you can mold this practice any way you want to make it, really.
So can you explain a little bit of what NSO is and the Tumani Center itself, and kinds of the things that it does overall, including health, but a little bit of the other things that they also do?
Yeah, it's a good question. NSO is probably the most misunderstood human service agency in Michigan. It's involved in lots of different projects, like older adult services. They have the suicide hotline and Gamblers Anonymous. They do life choices, which is developmental disability for adolescents and adults. And too many to even name. The most recent big project they had was renovation of the Bell Building. I don't know if people who have been in Detroit for a period of time remember the Yellow Pages building with the big Yellow Pages sign on the side. That was the Michigan Bell Building, and it was abandoned in 1984. NSO bought it and rehabbed it into 155 single-bedroom apartments as transition housing for homeless people.
Wow.
Plus their corporate headquarters are there.
Yeah.
It's a beautiful building. It's wonderful. They kept the old vintage look to it.
No, absolutely.
They have a wonderful lobby and music room, gymnasium. They have gardens on the rooftop. It's a great building. Yeah.
That's amazing.
Anyway, that's part of homeless recovery services at NSO. And where I work, the Tumani Center is a homeless service center in the Cass Corridor or Midtown.
Sure.
And it provides lots of different services. It's the CAM point of entry for people who are newly homeless.
Yeah.
And intake to services. They have respite care there. People stay there, sleep in chairs. We don't have any cots there. One of the purposes of that is so that there's no upper limit, of capacity. As the weather gets really cold, they'll let everybody in. I think we've had as many as 700 people in that room.
Wow.
Which is
that's a lot of people.
Literally standing room only. And the alternative would be if they would probably freeze to death if they weren't put in there. And other shelters, they have certain hours or rules and capacity they close. Everybody comes to NSO eventually. Unfortunately, it gets the nickname the shelter of last resort in the Cat's Corridor. It's kind of true.
Do we have an issue in Detroit with homeless shelters and not enough space and things like that? Because I think we've heard a little bit about that.
Yeah, they're just short of 2,000 beds in Detroit right now in homeless shelters, and about between 1,400 and 1,600 homeless. Am I saying that right? 14,000 and 16,000 homeless people
Sure.
in Detroit. So it's way below the capacity that we need.
So you talked about the buildings and things like that a little bit, but having done this for so long now, this many years, do you have any like specific patient interactions that stick out the most to you that you'd like to share with people listening or watching, that are just incredible, or like incredible stories of people, or can you just paint a picture of who these people are and what their stories are like?
That's a good question. The one gentleman that I remember quite well was he was somebody who had bad vascular ulcers on his leg, these wounds, chronic wounds on his leg, mostly from IV drug use. Now he hasn't been using in years, but the vascular problems persist. And so I was treating him with what is known as an Uniboot, which is just a zinc oxide impregnated gauze wrap. You change it once a week.
Sure.
You put Curlex or just roll gauze on the outside and then keep it in place with an ACE wrap. So it provides some compression and stabilization of the wound base. So anyway, I got to know him over quite a period of time. Initially, he was in treatment for drug rehabilitation, and they were very hesitant to keep him there until I made it clear that I would be coming once a week to change his dressings,
right,
so he could stay in treatment. So I got to know him well, and one of the students that I was with was kind of intrigued by him and wanted to do like a senior project interview thing with him, and so we got to know him quite well. And it's interesting because we all have these biases and stigma regarding all sorts of different populations, but in him it's like he's unfortunately a heroin addict in Detroit, but he's got a degree in literature. And he told me one of his first jobs, he was about 10 years old. He was growing up in a very fractured household. His dad was absent. His mom was an addict, and she was gone for most of the day. And his brother was considerably older. I think he was like in his teens, and he was absent most of the time. So he was there, 10-year-old, on his own, on Hastings Street, which is now I-375 here.
Oh, okay.
And so to make money, he would start a fire in a big 55-gallon drum and line the drum with bricks and warm them up, and then rent the bricks out to the hookers on Hastings Street so they could stand on them and keep their feet warm waiting for their jobs. 25 cents for a brick.
That's an incredible story.
That's the innovation required to survive in the streets of Detroit.
Very smart 10-year-old kid.
My goodness.
So you worked at NSO since 2006, and then street medicine started in 2012. And how did you get involved in street medicine?
That's interesting too, because there were occasions when I would learn of something untoward that had happened to one of our patients, and I'm knowing that I'm seeing patients that are residents of Tumani Center. They sign a list at the front desk, and then I call their names for the list, and they come back and I'm seeing. But in the back of my mind is, what's out there? What is in the streets right now lingering there that, say, people who are paranoid or been badly mistreated or whatever, and they don't come in for services. So that was, going on for years when a first-year medical student from Wayne State, Johnny Wong, came to us with this idea of partnering with NSO and doing outreach.
Mm-hmm.
Fortunately, my boss liked the idea, and we went with it. And it's proven to be a real boon for healthcare and for the homeless population in Detroit.
Sure. So, I think about that sometimes, being a part of Street Medicine Detroit, and thinking about how, it came into being, and how some of the stories that I've heard about it almost not quite going through, and like how it's kind of just tough to string everything together. But what a role that NSO and you obviously have played in, making it what it is today. It started in 2012, it's now 2019, 7 years later. What kind of evolution have you seen, with the impact of street medicine, starting out until now? Is there a difference in, the types of patients that we see? Do you see them more repeatedly now, more frequently, and have more continuity of care? Could you talk about that a little bit?
Yeah, well, that's exactly it. It's just we're getting to be more sophisticated in finding people, mm-hmm. and tying the clinic patients with the street unsheltered patients.
Yeah.
And actually getting like formal referrals from other agencies and things like that. It's kind of very gratifying.
So do you often see people, at NSO while you're working in your clinic versus when you go out on a street run with street medicine? Do you see at times the same people, mm-hmm. the same patients?
All the time.
Oh, wow. Could you explain kind of what that is like, what that's been like, having been such a role in that, and kind of the impact that plays? Like, how does that help the patient to such an extent?
It's multifaceted. One is just continuity of good care, that we're able to keep people on the medicine that they should be on, mm-hmm. and get them to appointments or things of that nature. But also, when a person that I have seen in the clinic at the Tumani Center is someone that we run into on the streets, it seems that they're kind of surprised and gratified to see me. Mm-hmm. And they will come over and, Nurse Dean, what are you doing here? And give me a hug. And it's like, I really can't recall what sort of encounter we had in the clinic, but apparently it was enough that they felt that connection. Wow. which really inspires me. That makes me feel.
It has to.
I know Dr. Bryce has talked about how we get more out of it than the patient. That's true, actually.
Yeah.
That's amazing. And do you find that, like, with street medicine, this is also part of the continuity of care? You talked earlier about how patients are often hesitant to seek health care because they might have had negative experiences in the past. And so with people kind of going out into the streets and reaching out to them, does that kind of help build trust? And is that why they're more likely to come and see you at NSO and kind of facilitate that continuity and
yes, not so much, just coming to NSO, but eventually agreeing to see us there on the street runs. Yeah. After they've seen us come 2, 3, 4 times, mm-hmm. and treat other people, yeah. And establish rapport with them, then they open up to us and learn that we don't bite.
And have you, when you go out on street runs with street medicine and with street cares, you interact with a lot of students and you observe how they interact with patients. Have you noticed any patient and student interactions that have stood out to you?
Oh, yeah,
that have been inspiring in any way?
Yeah, we recently just had one woman who was pretty ill and she didn't want to go into the emergency room, and but for the grace of the rapport that she developed with a student at that encounter, she agreed to. She even had difficulty standing, so the students had to lift her into the back seat of my car, and the student sat next to her holding her hand on the way to the ER. She would not have gone.
It's incredible.
I was not able to talk her into going to the ER. It was the student who did that.
Mm-hmm.
That's awesome.
How do you think that students are able to, reach this population in a way that maybe a practitioner like yourself wouldn't be able to?
I suppose it just has a lot to do with being genuine and connecting human to human.
Mm-hmm. Sure.
You would probably be able to answer that better than I could.
Yeah. I don't know. I was wondering if you feel like sometimes in the clinic you see people and sure, like they come to you a lot of times and you can help them out, but I feel like a lot of times the students are a little bit limited in like the healthcare that we can provide at times, and sometimes we can only do so much health-wise, but what we can really do, and I think what students are really good at, is connecting to the people, because a lot of times that is what we are doing a lot of. And so I think I was wondering if you had noticed that as well, or something similar to that.
Yeah, that's pretty accurate, I think.
Yeah.
All right.
I think it takes out that hierarchical relationship a little bit. It's just kind of a personal interaction.
Right.
So, also another thing. So recently we obviously had a huge polar vortex come through, and it got really cold. I don't know, was it a month ago now, a couple weeks ago? I'm not sure. It was in January, right? And so the Street Medicine Detroit, among other organizations like NSO and yourself, went out on these outreach runs to try to find people on these cold days and get them into shelters, or bring them food or hot chocolate, or jackets, blankets, gloves, etc. Anything that we could do to help that day. And so while I was out on the run with, I think Dee was out there as well, among other people, but we encountered some people that we would say, hey, we are bringing people to shelters. Would you be interested in that? It's going to be dangerously cold, like life-threateningly cold. Would you like to go? And a lot of people, say, no, I'll be okay. And we'll say, well, you remember, it's going to be very dangerous. Are you sure? And they say, yeah, I would rather stay out here than go to a shelter. And I just think to people that aren't experiencing that, I was wondering if you could elaborate on maybe like why that is. Why some people are so averse to going to shelters, and maybe what could be done to make it better too, if there's more resources.
Well, unfortunately, the funding for the shelters is always tenuous. There always seem to be working on soft money. There's never any real. It's grants from year to year or season to season. And so they have to make do with what they have. Mm-hmm. So things break down. The laundry's not working, or there's no hot water, or whatever. The shelter can be a horrible place to stay. It also can be dangerous. You're warehousing a whole bunch of people that have higher incidence of mental health problems and substance abuse problems. They did a study a couple of years ago about the hot spotting, in which locales in Detroit had the biggest number of 911 calls, and it was NSO.
Really?
Yeah, it was the highest number in the city.
That is interesting.
And they unfortunately run into staff members from time to time who treat them badly.
I see. Yeah.
If they've been treated shabbily, they're not going to return.
And this has been a problem that is kind of persisted over time. Is there anything that can be done to kind of address that issue so that we do have more sort of accessible and I guess shelters that people would want to use and attend?
Yeah, unfortunately, I'm not a good strategic thinker like that. I'm not. But overall, it would be if you just had better funding for facilities so that they had proper operating equipment and they could hire a sufficient number of staff. Like on the weekends, the whole NSO Tumani Center is run by 2 people.
Wow.
There are only 2 entry level front desk monitors there, and that's it.
Wow, I didn't realize that.
We're 120 or plus people.
That's really shocking, actually. And see, that's the thing, is that
it puts things in perspective when you realize the ratio of people.
Yeah, it's just such a huge problem and vastly underfunded and under thought of by the public at large. People are always, not always, a lot of people are looking away when they see the problem of homelessness, and they aren't working or like trying to address it themselves or like advocating for it. So it's something that gets pushed aside a lot of times, and there's people without a voice. These are people that really don't have the ability to speak up for themselves and have that voice in the public at large in the conversation.
They're invisible.
They're invisible, exactly. One of the other things that stuck out to me recently, we were at NSO, and we were interviewing some people that were staying there, and we, I think one of the biggest things asking people about homelessness is, how did you become homeless, right? And so we were asked, that was what we were asking, interviewing people was one of our questions. And everyone's, I think the general public's idea is that these people, are on drugs or just lazy or want to be homeless for some reason, or all these other things. And it's just simply not true most of the time. Of the 5 people we talked to, one person had been a victim of domestic abuse. One person had been injured. Her hip had been injured so that she couldn't go pay her housing bill that month, and so then she became homeless. And it was a problem that persisted because she couldn't get the care she needed. Another person was at school on loans, and they ran out of loans, and they had no support system to just pay their loans or pay the debt that they owed at that point for their rent. So they became homeless, and then they had a bunch of loan debt as well. Another person had been in physical domestic abuse with his family, was in a fight with family, kicked out of the house. And so this is a tiny sample size, but every single one of these situations just goes back to the issue of poverty and just a situation where people don't have a support system when things go wrong. And so I don't think people realize that, of how close people are to having to be homeless. It's just that most people have a support system that if something happened, they could fall back on. Do you feel like that is something that's pretty common in your experience?
Yeah. You bring to mind a patient that I had years ago who was working at an auto parts distributor somewhere downriver.
Mm-hmm.
And she was a high-low driver for this auto plant and got injured at work, injured her back, which required hospitalization. And when she was discharged from the hospital, she found out that not only had the company not been paying its workers' comp premiums,
mm-hmm.
it went belly up. It was bankrupt. It was closed.
Mm.
So she got out of the hospital no longer having a job and a $30,000 bill.
Yeah.
So she was living in her car just outside of the Tumani Center and came to see me for some, Motrin or something for her back, and liked the clinic and asked if she could shadow me. And I asked my boss, he said it was okay. So she shadowed in the clinic for a period of time, and then went to that, the Detroit Works project there.
Yeah.
And got to be a certified patient aid. Is that what the CPA stands for?
CNA, nurse aid, patient aid.
Yes.
Yeah.
And then later, when she got that job, she got out of the shelter, got her own housing, and then later went out to become an LPN. She sent me a copy of her LPN license.
That is
That's
incredible.
Awesome.
Very, wow.
But like you say, those were circumstances all beyond her control.
Yeah.
Exactly.
Yeah. It's so great when they're able to reach out and kind of find someone to guide them back.
That's what I think it takes a lot of times is, when there's no support system, it takes people to go and reach out and do the work that nobody else is willing to do.
Mm-hmm.
I don't think that we're being superheroes by doing it, but I just think that it's a decent thing to do, and everyone should be doing as much as they can to help all of us. We're all in this together, right?
These are our fellow citizens. They're all Michiganders.
Mm-hmm.
They're neighbors.
And even going back to the people that we interviewed the other day, a lot of them were working. They're working, and they aren't making enough money to support themselves or get housing. It's incredible what these people have to go through to get back on track, and because a lot of them are trying really hard.
And so we've heard so many inspiring stories about your work with patients and kind of the circumstances that lead people to become homeless. I know a lot of times they're out of their control. What would you say to people to kind of inspire them to get involved and kind of volunteer with NSO or other organizations in the community to help the homeless population?
I think just taking the time to talk with people and don't look at them as homeless people. Just look at them as people who happen to be experiencing homelessness.
Right.
And once you make that human-to-human connection, you recognize where the gaps are and how you'd be able to help out.
Yeah, for sure.
Not necessarily monetarily, it's like just giving of your time or talent.
Exactly.
So I guess to ask you one final question, just to wrap things up, as you continue to work with these street medicine organizations around the city, what are some things, like what will it take to reach, what's the next step in making another like bigger impact? What is the next step for street medicine? What does that look like in Detroit?
I could say in one way it would be good if we were to expand to the east side.
Yeah.
And have more of a footprint there.
Yeah.
But I think ideally if we were formally collaborate with all of the other outreach programs and operate off of the same electronic medical record and have, share resources in that regard, I think that would be helpful, because I know that they have medication that we need and we have medication that they need and things like that, or there's duplication of services, or worse than that, the gap in services where somebody assumes something is being taken care of by someone else.
Right.
But if that came to pass, I think we would have a greater impact. Ultimately, the punchline is always going to be housing. If we can just increase housing in the city, then reduce this burden on the city.
So just figuring out that synergy with everyone that's already doing work and people who are going to start doing work, hopefully, and getting on the same page and maximizing what we are putting in to it as it is.
For sure.
Yeah.
This has been amazing, and it's been so great to have you on the show. Thank you so much for talking to us.
Thank you for inviting me.
Yeah,
Thank you so
for
much.
everything you do in the community with NSO, with street medicine.
I'll tell you, it doesn't happen without students. I mean, the energy and insight that the students bring to the program is just amazing. It keeps us going.
We learned so much from you.
We learned so much. I think you inspire all of us when we go out on runs and see the way you interact with patients. So I look forward to seeing you on my next street run, and we will see you soon. Thank you.
Yeah, thank you.